Hello, this is Cal Burgess with CustomInsured, and thank you for listening. So, over the next few podcasts, what we're going to do is redirect our focus on how to implement superior group health plans for small businesses. And what we did, or the goal with setting all this up, was to provide an educational means for employees to reference group health plans, to find the best way to approach a group health plan, and to understand in general how it works. So our objective with all of this is to show employees how to minimize their out-of-pocket exposure while bringing more doctors and more surgeons that they have access to. Whereas with the employer, we're showing how to minimize renewal rates, have more affordable premiums off the bat with lower deductibles, essentially giving better coverage for the company as a whole. So with that being said, in this particular episode, what I like to do is focus on introducing the new health plan to your doctor's office. I can't tell you how many issues I've seen with this, and a lot of it is just simple mistakes or miscommunication between the patient and the billing office. That is an easy transition or an easy objection to overcome, at least in more cases than not. So it's important to understand what a billing network is. So we'll discuss that first, and then show how to sidestep these issues. So a billing network is a intermediary, usually is anyways, between an insurance company and a doctor's office, and it provides a couple of benefits. Number one, it allows the billing to be a seamless process from the doctor's office to the insurance company, and at the same time there's a contractual guarantee that the patient's going to receive the best possible pricing, so you're not going to be overcharged. Now, the way it works is, as soon as you step outside of that network, that repricing, or the balance billing we refer to it as, is off the table. So because they don't have the seamless billing process, if someone doesn't have insurance or has insurance outside of that network, that doctor's office or the hospital is usually going to charge them more to offset the exposure that they have moving forward. And the exposure they have is, number one, if a person doesn't have insurance, it's unlikely they're going to get paid for that. And then number two, the last thing they want to do is go on a monthly billing plan with the patient who is unable to pay. And anyways, right or wrong, that's the ideology behind of how it works. So with that being said, it's important to have the right network when you set up a group health plan. What I always encourage all my clients to do is enter their doctor on the network, which if you ask your agent, they should be able to provide you with a portal, if you will, to be able to look up which doctors participate in that network and which ones do not. So when you look up your doctors in there, what I recommend is to print off proof that doctor's part of that network. Therefore, when you give the billing office your insurance card along with the network showing that they're in it, it's easy for them to match it up. Because what happens is the billing offices get overwhelmed. They have a lot of work that they're trying to get done. And the first thing they'll do is look at an insurance card. And if they don't recognize that card or they don't recognize that insurance company, their initial response is to say that, hey, we don't take this insurance. And that's not correct. A lot of them do take the insurance. It just needs to be billed through the network as opposed to the insurance company. So to learn more about how to expand your network and how to double check your doctor before you go in, please let us know. Reach out to us. You can reach us at CustomInsured.com. There's several ways to contact us, from webinar to a phone call to a one-on-one coffee. Please stay tuned. There'll be several more episodes to follow. And thank you for listening. This is Cal Burgess signing off.